Hello, I'm Steve Collins. I'm a doctor of Chinese medicine, and today we're going to talk about Chinese medicine, what it is, how it works, and some of the tools that we use when treating patients. Now, Chinese medicine has a history of over 3,000 years. It is a very clinically relevant medicine, and today it is just as powerful as it was 3,000 years ago. It is a fully developed medical model. It is separate from Western medicine. By fully developed, that means that it can handle many different problems, many different complaints. There are some things that Chinese medicine does very well. There are some things that, like Western medicine, it doesn't do so well. Part of the job of a doctor of Chinese medicine is to be able to differentiate those things and to be able to say, well, these things that Chinese medicine can handle, we can possibly help you with. One of the central concepts of Chinese medicine is that of Qi. What is Qi? Qi is nothing mystical, it is nothing magical. All that Qi is the fundamental energy of life. Every living thing has Qi. Insects, plants, animals, people, every living thing has Qi. In people, Qi is that which allows the heart to beat, it allows the nerves to conduct impulses, it allows the blood to flow. Sometimes Qi can become stagnated. Sometimes it can become deficient. Sometimes it can essentially become out of balance. When Qi is out of balance, disease or pathology presents. Chinese medicine is essentially all about maintaining balance or restoring balance to the body. And we do this by harmonizing the body's Qi. Sometimes we strengthen or cultivate the body's Qi using several tools such as acupuncture or herbs. Now, how does Qi flow through the body? Qi flows through the body through a series of channels or meridians, some of which you can see on this diagram. The best way to think of these channels is to imagine a river. And you know how water saturates the banks of a river? Well, that's how Qi saturates the tissues. It flows through the channels. And we can access the Qi through a series of points. There are over 360 points on the body. Think of these points as ports along the river. Some of these ports are little one-horse towns with a stop sign and a post office. There's not much there. Some of these points are major points that have influence on many different parts of the body and communicate with other parts of the body. So there are essentially two difficult parts of Chinese medicine. The first is figuring out what's going on with the patient. And the second is determining which points to use to treat a given problem. Once we determine what's going on with a patient, then we can use a number of tools to treat that patient. Now, in Chinese medicine, when we talk about organs, and we talk about the heart and the lungs and the spleen and the kidney and the liver, we're talking about a whole constellation of things. For example, the heart. When I talk about the heart in Western medicine, I'm talking about the myocardium, and only the myocardium, and the electrical system that runs the heartbeat. But in Chinese medicine, when I talk about the heart, I'm not talking solely about this. I'm talking about a whole constellation of things, including the small intestine, summertime, the color red, the tongue, the emotion of joy, hot foods. So I'm talking about a whole constellation when I talk about the heart. And one of the wonderful things about the medicine itself is that it does not separate mind from body. And it looks at the body as a whole. So when I talk about the heart, I'm also talking about its relation to the kidneys. I'm talking about its relation to consciousness or awareness. I'm talking about its relationship with dreams. I'm talking about many, many things. And so when a patient comes to us with complaints, after a thorough examination and looking at the tongue and feeling the pulse in each wrist, both of which are extremely important diagnostic tools in Chinese medicine, we can arrive at what we call a pattern, which is the same thing as a diagnosis, or equivalent to a diagnosis. At that point, then we can determine which points to use to treat the patient, and then which tools we're going to use, whether we're going to use acupuncture, cupping, Gua Sha, Tui Na, dietary therapy, herbal therapy, plum blossom, or whatever technique we choose. So in the next few minutes, I'm going to demonstrate some of these techniques. It's important that you understand that if you choose to go to a doctor of Chinese medicine, that you find a practitioner that has gone through at least 3 to 4 years of education in Chinese medicine. I myself have had 4 years of school in Chinese medicine. In many states, different professions can study a very short amount of time, about 100 hours, place needles in you and call it acupuncture. So you must make sure that the practitioner that you see is a doctor of Oriental medicine or a licensed acupuncturist. Chinese needles are different from Western needles in several aspects. You know how when you go to the doctor's office and you get a shot, it really hurts? Well, that's because those needles are about this big, and they're hollow. And at the end, at the tip, they're cut on a slant. It's called a bevel. Chinese needles, on the other hand, are solid. They're about as thick as one of the hairs on your head, and at the tip, they're rounded, sort of like a ballpoint pen. So when I place them in your body, actually, two things don't occur. You don't bleed, and it doesn't hurt. Now, you might feel the needle break the skin, but it's certainly nothing compared to a hypodermic syringe. So now I'm going to place a couple of needles in Tracy for general purpose. This is a treatment that it's a general purpose all-around treatment designed to kind of harmonize her qi and to strengthen her qi. The first needle I'm going to place, however, is not part of the general prescription. It is a point right between the eyes that I usually put into new patients because it's a wonderfully calming, centering point. Typically patients who get this point request it over and over again. Now, when I put the needles in, I'm looking for a feeling of heaviness or dullness or a throbbing or an aching. The first time I put the needles in, it's not uncommon for patients not to experience that, but typically after 2 or 3 treatments, they feel it. All right, this is a 40 gauge needle, 1/2 inch. This is the smallest needle that I use. These are the needles that we place in the face and in very sensitive areas of the body. So I'm going to place this in our model's forehead. There. Okay. Now I'm going to place some needles in her legs. Okay. Now I'm going to place needles in a point along the spleen channel and a point on the stomach channel. So what I'm doing is I'm finding the point. The point's in a generally a specific area, and then I can feel the point. So I locate the point and place it. That's it. How do you feel?
Fine.
Okay. I'm going to place the next needle in the opposite foot, same point. There. Okay. And now for the points on the stomach channel. All right, so I've just placed needles in our model's legs. If she were a real patient, I would leave the needles in for 20 minutes. I would leave the room, come back after 10 minutes, and stimulate the needles. What that means is I would kind of tweak them or twist them a little bit, and then leave and come back after another 10 minutes for a total of 20 minutes. And that would essentially constitute a treatment. Now, the choice of points is not arbitrary. What that means is if you ask 4 doctors of Chinese medicine for a list of points for any given conditions, you can get 5 different answers, and they can all be correct. So there are many paths up the mountain to treating a patient. I prefer to use the fewest number of points possible. I'm going to tweak the needle. I want you to tell me when it feels heavy. Or aching.
Okay.
Okay. At this point, I would leave the needles in for another 10 minutes. Okay. At the end of the treatment, I'm going to remove the needle. See, no blood. I remove the needles, I put them immediately into a disposable, what the hell is it called? As I remove the needles, I put them directly into a sharps box or a disposable box that I send off and have the needles disposed of. So when I put the needles in, what am I doing? What am I treating? Well, let's say a patient comes with a complaint of headaches, for example. In Chinese medicine, any given complaint, such as headaches, I don't see it as your primary problem. I see headaches as a branch response to a deeper problem. So if I can determine the root cause of the problem, and I can treat that problem effectively, then the branches kind of take care of themselves. Now, there are times when I can put out fires. For example, if you walked in the door with a splitting headache, I can many times get rid of that headache within 5 seconds with acupuncture. But that doesn't get rid of the cause of the headache. To do that, I have to go to the root problem. And that's one of the wonderful differences between Western medicine and Chinese medicine. Now, Western medicine is by far the most powerful medical model on the planet. No one should dispute that. Anytime that you can give a patient a medicine, put them asleep, cut open their chest, operate on their heart, and wake them up again, that's pretty powerful. Chinese medicine is by far the most elegant model on the planet. It works much more subtly, but much more elegantly by harmonizing the patient's body. It is a very clinical, efficacious medicine. It has obvious, measurable results. So the purpose of putting in the needles is to effect a positive change within the patient's body, essentially allowing the body to balance itself without using an outside influence such as medication. There are certain points that can be used to treat specific conditions. For example, if a patient is complaining of low back pain, there are certain points that we know are very good for treating low back pain. One of these points is on the ankle. Now remember, this medicine is counterintuitive. To the Western mind, it doesn't make sense. Why would I put a needle in the ankle to treat your back? Well, the fact is, it works. So I'm going to show you that point. Although our model isn't complaining of low back pain, for the sake of this demonstration, I'll put the needle in. This is a point on the bladder channel, right here. This is point number bladder 62. And we choose this point for several reasons. One, because the bladder channel itself goes all the way up the spine to the back of the head, and it actually begins, it starts at the eye, travels over the head, over the scalp, down the back of the leg, and exits at the toe. But this particular point is very good for treating low back pain. I'm going to use a guide tube to assist in this point. There, feel it? Typically, this is one point of 2 or 3 that I would use to help relieve pain. Depending on where along the back it is, I would use points either on the hand or the back of the knee, or sometimes in the back itself. What I would tell the patient is, you might feel your back kind of opening up or relaxing. That's not uncommon. I'll leave the needles in for 20 minutes. After 10 minutes, I come in and tweak them. And then following that, I typically do Tui Na. And usually, that's when we get the best results. There is another form of treatment called Moxabustion. Moxabustion involves burning moxa, or the herb mugwort, over a given acupuncture point for the effect of strengthening or tonifying that point. This is a stick of moxa. Moxa comes in several forms, and this is one of the most common forms, one of the easiest to use. I'm going to light this, much like one would like light a stick of incense. And what I would do is hold it over a given point and tell the patient, once you start feeling it get warm, let me know.
Okay.
Now, I can do this either with or without a needle in place. For the sake of this demonstration, we'll do it without a needle. So just rest your hand and then tell me when you feel it get warm.
I can feel it.
Okay.
I can feel it.
And we would repeat this about 5, 6, 7 times on any given point. And that's Moxabustion. Now, the more modern way of doing Moxabustion involves using a heat lamp and a spray form of Moxa. And the reason for that is the stick has a very pronounced odor to it. So the other way with the spray, the heat lamp avoids that odor and you achieve the same results. Okay, there's sometimes when I would want to perform Moxa with a needle in place. So I'm going to use this point, the 4th point on the large intestine channel, Li4, or Hegu as it's called in Chinese. Okay. Now, once I have the needle in place, I will take some Moxa spray, spray it. This is a far infrared heat lamp. Okay. The light from this is invisible, but you can feel the heat. So I would take it and place it over the point like such. And leave it there for 20 minutes. A third form of Moxa is a cone that we can place. It has a little bit of a sticky bottom, and we can place it on a given point, and we light it with a stick of incense. There we go. Now, you tell me when you start to feel it get warm. Just put it in the holder.
Okay, I can feel it.
Okay. At that point, we remove it and put a fresh one on. That's still another form of Moxabustion. Tell me if that's too hot.
Oh, no.
One of the oldest forms of treatment is something called cupping. Cupping involves taking a cup, and there are 2 ways of doing it. The classical method called fire cupping, which I employ, and then there's a modern method using suction cupping where they attach a gun and suck out the suction. Personally, I think that technique has very little merit. It does achieve the suction, but you lose quite a bit of the potential of cupping by doing it. So what I'm going to do is take a piece of paper, light it on fire, place it into the cup, and then place the cup on her back. What will happen is the fire will go out, she will not get burned, but it will cause a suction, pulling out toxins and such from the body. onto the paper when this is removed, you can see the amount of air coming in. Now I'm going to do the same technique by using a needle under the cup. Alright, so I'm going to put a needle in. And then place the cup over the needle. The reason I do this is because that makes the effect of both the needle and the cupping synergistic and much more profound. Okay. Let's see the difference. Cool, huh? The paper that I use, I found the best paper to doing cupping is table paper. The paper that you go to the doctor's office and it's on the table. That's all that this is. It just happens to burn very nicely. So a third form of cupping is called sliding cupping. What I'm going to do is take some massage cream, place it on her back to give myself a medium to put the cups on. So the cup is on her back. Now I can move the cup, slide the cup along her back. Okay. If her back was bare, I could move all the way up the length of her back without losing suction. That's sliding cupping. When I perform cupping on a patient, it's important to tell them that they will have a black and blue mark. It won't be painful, but it will last several days. Typically, I tell patients that they look like they've been attacked by an octopus. Okay, Gua Sha is a scraping therapy. It's again a very old treatment. Some call it a folk treatment. It is a wonderful treatment for fevers. It's also a great treatment for certain muscle aches and musculoskeletal conditions. Basically what I'm going to do is rub some, this is Dragon Balm, very similar to Tiger Balm. It's a liniment that you place on the body. Then I'm going to use the lid to scrape and raise what we call Sha. Sha is kind of like toxins under the skin. What you'll feel is it gets warm at first and then it cools off. And it looks almost like it should be very painful. It looks like road rash, but it truly isn't. It does feel good. How are you doing?
Okay.
That's a nice amount of Sha there. Now, there are certain aspects of this medicine where you have to take off your Western clinical hat and put on your Chinese out-of-the-box hat. What I'm about to do is one of those. It is called Qigong. Qigong itself refers to the cultivation or the strengthening of one's qi, internal energy. But you can also use that, you can transmit it to other patients for a healing effect. So it is essentially Chinese energy work. It is the precursor to Reiki or therapeutic healing or healing touch, any of those hands-off energy works. This is the original. So what you'll see and what the patient feels are two different things. What you'll see is just me holding my hands over her body. What she feels is something different. I'll be the first to admit that Qigong is a little bit bizarre. It's a lot outside the realm of Western thought. It can't be quantified. But just because I can't prove that it doesn't exist doesn't mean it doesn't exist. I can't prove that your mind exists either, but I'm sure you have one. So what I'm going to do is allow my qi to circulate and to essentially expand out through my palms and transmit it to her body to effect a healing response. Typically what patients feel is a sensation of warmth. So here we go. I typically place one hand on the patient's skin somewhere, in this case her arm. Often it's a forehead. Although it's not necessary, you can do it hands off completely. But most of the work is coming through this hand for this particular technique. So this is it. typically patients go into a pretty deep state of relaxation. How do you feel?
Relaxed.
What did you experience?
Just warmth and relaxation.
That's Qigong. When we talk about the flow of qi through the body, there are several points that are pretty heavy energy centers. We call them the dantian. The primary dantian, the most common one, is right below the belly button here. There's also one in the middle of the chest here, and there's one at the forehead where I put the needle originally. So by kind of getting all three of those to open up and to harmonize and to communicate, you can affect an incredible cycle, a wonderful flow of qi. In Chinese medicine, two of our diagnostic tools are the tongue and the pulse. Now, when I look at a patient's tongue, I'm looking at several features. I'm looking at the shape of the tongue, whether there are tooth marks or not on the tongue, the color of the tongue, the coating on the tongue, the color of the coating on the tongue, several different things. And what does that tell me? Well, it tells me the state of the inside of the body. It points mostly to the stomach and the digestive system, but it can also tell me quite a bit about other aspects of the body. So if we look at her tongue, and I just want you to lay it out there. Okay, we can see that it's pale. It has tooth marks on the side, and it has a very slight quiver, but the coating is actually pretty good. A little bit of yellowness to the coating. You can relax, thank you. Now, after looking at her tongue, what that tells me is she has, in Chinese medical terms, what we would call a qi deficiency with a little bit of associated heat. Now, I don't know exactly where that heat is coming from. I can guess it's probably coming from the stomach or the guts somewhere, but I'm not sure. So to really nail down some things, I'm going to take her pulse. I'm going to take her pulse in each wrist. Now, in Chinese medicine, when I take the pulse, I'm taking it in each wrist in 3 spots on the wrist. On each spot, I have 2 depths, a shallow and a deep depth. So I'm feeling a total of 3, 6, 12 pulses. So there's a lot of information. Now, in Western medicine, when we take the pulse, the only thing we're concerned about is how fast it's going and if it's regular. In Chinese medicine, the pulse tells us so much more than that. So, for example, I will just take her pulse on her left side. Now, each of these 3 positions corresponds to an organ, and the same on the right. So by feeling her pulse, what I'm feeling for is the quality of the pulse. And there is something like well over 20 descriptors of the pulse. Things like slippery, wiry, tight, short, long. Many different qualities of the pulse. So by taking her pulse on each wrist, that can tell me about her organs or the state of her health. And that's what you can determine from the pulse. Now, a little bit of trivia. You can tell if a woman is pregnant by the pulse. You can tell the sex of the baby by the pulse. And I've done both of those things successfully myself, so I know that it can be done. The 3 places on each wrist are right next to each other. There's 1, 2, 3 places. Each place corresponds to a different organ. For each one, there's a depth, shallow and deep, depending on how I press. Each one I'm feeling a shallow and a deep pulse. So that's 3, 6 per wrist for a total of 12 pulses that I'm feeling. Still, another treatment modality in Chinese medicine is Chinese medical bodywork, or Tui Na. Tui Na is a wonderful tool for patients who complain of anything from musculoskeletal complaints such as back pain or neck pain, or victims of car accidents. It can be used in things like fevers. It's the treatment of choice in children. Tui Na, there are many different styles of Tui Na. The Tui Na that I personally practice is something called dynamic Tui Na. And it's a wonderful set of techniques for relieving pain and for helping the body realign itself and to heal. So, some examples of Tui Na, for example, someone complaining of shoulder pain might be to help release the shoulder. Someone complaining of low back pain, I might release the hips. So for more information on Tui Na, check out my video on the subject or massagenerd.com. Also, you can get information about me through my website, Qidoc.com. That's QIDOC.com. In Chinese medicine, our pharmacology is herbs. Chinese herbology is a subspecialty of the medicine. You don't need herbs to practice the medicine, but they can get things done quickly or more dramatically. Chinese herbology is very different from the European tradition of herbs. In Chinese herbal medicine, an herbal formula can contain anywhere from 2 to 14 or 15 different herbs. And each formula typically is individualized for a given patient. The way that Chinese medicine looks at herbs is that anything that you can put into your body, food, herbs, anything, has a specific effect on the body, and everything that you ingest has certain qualities, such as coldness or heat or bitter or sour, different flavors. For example, certain herbs such as ginger is very warming. Ginger is what we call pungent, so it moves things and it tends to calm the stomach. Other herbs such as ginseng, or in Chinese renshen, is a very important herb. Ginseng is not the kind of herb that we would give indiscriminately to people. Unfortunately, in this country, ginseng has been touted as a cure-all for almost any condition, and it's not. It truly isn't. Ginseng, there are actually several different kinds of ginseng, and depending on your complaint, that would dictate the kind of ginseng you would be on, what herbs we would pair it with, and how long you would be taking it. To take ginseng indiscriminately is equivalent to taking penicillin indiscriminately just because you think you need it to ward off colds.
So would the body get immune to the ginseng like it can get immune to penicillin?
Well, that's a good question. If it could build up a tolerance to ginseng. The other thing is, if you don't need ginseng and you're taking it, it's not going to do any good. It's the same thing as if you don't have a cold and you take penicillin just because you think you should take it to keep away a cold. It doesn't do any good.
But doesn't do any harm either, though, right?
Well, that depends. See, just because a product is natural doesn't mean that it's safe. And herbs can interact with medicines. Ginseng can have a profound effect on a person taking Coumadin, which is a blood thinner. Ginseng can prolong bleeding time. So if you're on Coumadin and you're taking ginseng, that's not a good combination. And there are many, many interactions between medications and herbs. And that's why it's so important to see a doctor of Chinese medicine before you start taking any herbs.
Thank you for that advice on herbal medicine.
You're welcome. So today you have seen many different faces of Chinese medicine. As you've seen, there are many aspects to this complicated medical model. Acupuncture is just one tool, but I've shown you many of the other tools, including cupping, Gua Sha, or scraping, Tui Na. We've talked about herbal therapies, and there are even more tools that we have yet to talk about, such as dietary therapy. Chinese medicine is a wonderful medical model. Chinese medicine is good for many, many conditions, such as painful conditions, chronic conditions, conditions such as fibromyalgia or diabetes. Chinese medicine can be used in many, many cases. Many times when Western medicine doesn't quite seem to have the answer. In addition, Chinese medicine is also very effective in cases for smoking cessation, or one of the hot new areas is cosmetic acupuncture. For example, acupuncture facelifts, which is very exciting and has wonderful results. So if you're curious, ask a doctor of Chinese medicine, and remember, you want to ask for someone who is either a doctor of Oriental medicine, an acupuncture physician, or a licensed acupuncturist who is board certified through the NCCAOM, which is the board that certifies doctors of Chinese medicine in this country. For more information, you can either contact myself, Steve Collins, directly through my website, www.qidoc.com. That's QIDOC.com. Or you can email me at qidoc@qidoc.com. Or you can contact massagenerd.com, N-E-R-D. And be sure to check out all the other videos and DVDs in this collection. There are many more that can be potentially helpful to you and give you a wealth of information. Thank you so much for watching me today. I hope that it's been educational and enjoyable for you. I hope to see you again.